Hello and welcome. This is Dr. Mo, a cardiologist and an electrophysiologist with James River Cardiology. If you're watching this video, then it means that you or one of your loved one was diagnosed with AFib. During this video, we're going to talk about AFib, the symptoms, the treatments, the risks, and how can we go through this journey together. To start, let's talk about AFib. AFib, or atrial fibrillation, is the most common rhythm problem that can happen to people. Millions of people are diagnosed with AFib every single year. AFib is an irregular heartbeats that happen in the upper chamber of the heart. Symptoms include short of breath, chest tightness, or palpitation. And some people will have dizziness. Most of the people will not feel anything at all. Why should someone be concerned about AFib? Well, AFib increases the risk of stroke, which could be a life-changing event. And that's why, depends on your risks, you're likely going to need to be on blood thinner to prevent you from having strokes. Not only that, but it can also increase your risk of having heart failure. And those are the main reasons why we need to be more aggressive in fixing AFib. And now we're going to talk about atrial fibrillation ablation. It's a minimally invasive procedure that is done in the hospital. It's a one-day procedure where the patient comes in, get the procedure done, and go home on the same day. Steps of doing the procedure. Number one, you're going to be under general anesthesia, which means that you're not going to feel anything throughout the procedure. After that, we're going to access the groin 3 times to have 3 catheters that goes all the way up to the heart. When we reach the heart on the right side, then we cross to the left. On the left side, there is 4 veins that comes into the left side. AFib comes from those veins. If we isolate the veins from the heart, then AFib should not happen again. Previously, we used to do the procedure or the ablation with cold and heat. Today, we do it with something called pulse field ablation, which is safer and faster than the old technology that we used to have. After doing the procedure, we move all the catheters out of the heart and then outside of the body. You're not going to have anything inside your heart when we are done with the procedure. Talking about the safety, the chance of anything bad happening is 0.6%, which means that there is a 99.4% chance of nothing bad happening, and the patient is going to go home on the same day. Risks include bleeding. The risk of bleeding is 1 in 1,000, which means that if we do this 1,000 times, one might bleed. If you do bleed, we're going to hold some pressure and the bleeding is usually going to stop. If it doesn't stop, we need to do ultrasound, x-rays to find out what's going on. When we have catheters inside the body can look at those catheters as foreign material, and it can form clots around those catheters. If that clot goes to the heart, it can cause you to have a heart attack. If it goes to the brain, it can cause you to have a stroke. Knowing that, you're going to be on blood thinner throughout the procedure to make sure that this is not going to happen. And lastly, when we have catheters inside the heart, there is a chance that those catheters can damage the heart muscle, and if that happens, you might bleed in the area around the heart. And if that happens, we need to put a drain to drain it. And if that is not enough, we need to very rarely open the chest to fix it. Having said all that again, there is a 99.4% chance that nothing bad is going to happen. So overall, it's a very safe procedure to do. Talking about the efficacy of the procedure, it depends on what type of AFib you have and how much scar tissue you have in the upper chamber of the heart. In people who have no scar tissue, they have an 85% chance of success, which means after doing the procedure, there is a 15% chance of having AFib compared to 100% in people who do not do the procedure. In some people, we need to do it again, which is safe to do. After doing the procedure, there is a blanking period of 3 months where people can have AFib during that time. And it doesn't mean that the ablation failed. It just means that we need to give the heart some time to heal and recover before assessing the efficacy of the procedure. If you have AFib during those 3 months, don't be alarmed. It's expected for some people to have AFib during that time. We just need to wait for those 3 months to be completed. If you're struggling with AFib, you don't have to go through it alone. We are here to help you through this journey. Thank you for watching this video, and I'm excited to see you in clinic to talk more about the ablation and to answer all your questions.